Experts estimate that up to 80% of the population will experience some sort of back and neck pain at some point in their lives. So is that you? Are you looking for relief? Well, today we have our expert, Dr. Christopher Miller, back in studio with us, along with one of his patients, Bill. Thank you to both of you for joining us today.
It's great to be back.
Yeah, so Dr. Miller, we hear time and time again, people are debilitated from neck pain, back pain, sciatica. Exactly what does this mean for people and what you do at your office?
Well, sciatica can be a big problem for a lot of patients, and basically the sciatic nerve is the largest nerve in our body, and it runs down the leg. And so when that nerve gets pinched or irritated, it can be a number of different symptoms, from an electrical sharp shooting pain that just literally stops you in your tracks. Sometimes it's numbness and tingling, where you're having trouble feeling that leg or even your foot or toes. Other times it's more than just like pain or these achy sensations, but there's a physical component where that leg might start getting weak, and then there's problems walking or concerns falling down. But there's a number of different conditions that can pinch that sciatic nerve, and we try to, our approach at our office is not just mask those symptoms. We try to get to the root of the problem and correct that so patients can, get back to a normal life once again.
Yeah, we hear so many of your patients, they're suffering from sciatica, but that can actually be just a symptom of spinal disc disorder. Can you explain what that is?
Exactly. So the intervertebral discs are these pads and cushions and spacers that are between each bone in our spine, and with stress in our lives and neglect, they'll start to dry out, and because of that, it's almost like a sponge that dries out, where they start thinning down. That would be degenerative disc disease, where the bones get closer together and start pinching the nerve. Or even worse, sometimes these discs can start to rip or tear, and then they start pushing out, which is a bulge or a herniated disc, and just very painful conditions. These patients have a tough time, not just enjoying life, but doing your normal functions and chores throughout a day because of the limitations with that.
Yeah, oftentimes people that are experiencing this type of severe pain are kind of at the end of their rope. They are trying a lot of different options. Some of them are injections, surgery, medication every single day, and oftentimes this is just masking the pain.
Exactly, and that just adds to the frustration for these patients, because I think most people we meet with are looking for real solutions and want the problem fixed. But when you just simply mask the pain temporarily, that problem persists, and over time it gets worse, and it leads to more pain and more frustration.
Yeah, so you're welcoming people into your office, and one of those patients is Bill, here today in our studio. Bill, thank you for coming in and telling us all about your journey. You have had years of pain, but prior to your pain, you were actually a long-distance runner. Tell me a little bit about your journey.
Well, first of all, you're right. I was very active. I love to run long distances. I love to snow ski in the wintertime. And I actually played a lot of volleyball, sand volleyball. I've had spinal stenosis for a long period of time. And then what happened was a surgeon decided that maybe we should do some laminectomy on you, possibly. And I thought that's not the way I wanted to go. And there's got to be other ways, having surgery, because after you turn 70, having a major surgery is questionable, I feel. So I looked for somebody who is modern and somebody who can give me definitely a new way of treatment. And fortunately, I found Dr. Miller. And what doctor, as soon as you sit down with you, he asks you, I'd like to see an MRI of your situation. He wanted to see an MRI of me, and we had it scheduled. I had one. And he diagnosed my problem to me, myself. And this helped tremendously, because it's an individual thing. And he's got exercise programs, and he has equipment that help me. And now, before I saw him, I was walking around with a cane. I don't walk with a cane anymore.
You didn't walk in here with a cane.
I don't walk with a cane anymore.
Congratulations.
That's amazing to me. Thank you, doctor.
Yeah. So talk to me a little bit about the pain that you had prior to coming to Dr. Miller.
Well, the pain I had was, it started right in the middle of the back, L5, down the right hip, down, tingling down to the toes. And anybody that has never had that, you can't explain the pain, but you're always trying to be in a good mood and a happy person that I am, but it's difficult to be that way. So that's the pain I had most of the time, especially when you get up early in the morning. But now it's a relief.
Well, before we started, you told me you have a lot of jobs right now, and they're right there on your t-shirt. 3 grandchildren that you need to be very active for. And so I'm so happy for you that you get to live the life that you deserve and that you expect to have.
Thank you. I want to go skiing this winter with Samantha, Lindsay, and Bailey at Boyne Mountain.
That's amazing. Congratulations to you.
Thank you.
Dr. Miller, you know, we have that MRI here to show about Bill. So tell me a little bit about what you saw when you took this MRI.
Well, it wasn't good, Jordan. This is Bill's MRI, and this is a side view of his lower back. And if you look down the middle from top to bottom, there's a lighter strip there, and that's supposed to be an even strip all the way down, which is the spinal cord and the nerves. But those arrows are pointing to a lot of black areas there, which basically Bill had severely degenerated discs in his lower back. And those black areas are herniations of these discs pushing into his spinal cord and nerves. That's what was affecting his back pain and that sciatic nerve that went down his leg. You know, and our decompression program that I encouraged him to do and offered to him is a medical device to help heal and repair these injured discs and damage to the spine. So, you know, with this treatment, we're able to draw these herniations in away from the nerves and actually start to rehydrate those discs so they can thicken up. And, you know, the reason Bill's doing so well is because we're working on correcting the condition. You know, again, we're not just trying to cover up the pain temporarily. And, you know, you can see how encouraged he is.
I know.
You know,
it makes me smile because you can tell how happy Bill is. You utilize the DRX machine. Can you tell us a little bit about how that works?
Basically, I mean, there's a lot of technology involved with this, but computers control how it's working with the patient, so it's interacting with them during the entire course of the treatment. But, you know, they just basically lie there still. It's a very gentle, usually relaxing stretch on the lower back or the neck, whatever the problem is. A lot of those patients just take a nap and sleep during the treatment because they're so relaxed and comfortable. But what it's actually doing inside is reversing those degenerative conditions, getting the discs in their spines healthier, you know, so they can do the normal things they want to do once again. And
Dr. Miller, I've been to your beautiful office, and you have photos of not all, but many of the patients that you've been able to help with the DRX machine. It's really incredible. And I'm sure incredible for you and your team to see someone walk in with a cane like Bill and then now walk out with a big smile on his face. It's got to make you and your team feel just excellent. Absolutely. It's super rewarding and just so much fun working with patients like Bill, and, you know, just it's hopeful and a lot of fun, and, you know, we've had a good time working together. Yeah, well, I can't imagine the pain that Bill was in, but I know that some of our viewers can. So you want to help all of these people, you're offering a special. Absolutely, and we are essential workers, so we've been open during this whole pandemic, and we do a lot of things to keep it safe. But if patients are interested in getting their problem fixed, give our office a call, and for $49, we'll do a consultation and do a physical examination to start getting to the root of their problem. And then as a special for the first 3 callers, we'll also do a free MRI review where, like I did with Bill, I'll show them their MRI and point things out so they can actually see with their eyes what's going on and why they're hurting so much. An individualized approach that people love you for. So thank you so much, Dr. Miller. Thank you. Good to be back. Bill, you have fun on the slopes next year.
I will.